Addiction is a neurological disorder that rewires the brain's reward system, primarily affecting the mesolimbic dopamine system. This system includes the ventral tegmental area, VTA, nucleus accumbens, NAC, and prefrontal cortex, all of which regulate pleasure, motivation, and impulse control. Normally, dopamine is released in response to rewarding activities like eating or socializing. However, addictive substances flood the brain with dopamine, overwhelming the system and reinforcing compulsive behavior. Repeated drug use alters brain chemistry. The brain compensates by reducing natural dopamine production and receptor sensitivity, leading to tolerance, needing more of the drug for the same effect, and withdrawal, painful symptoms when the drug is absent. These changes make addiction a chronic, relapsing disorder. The 5 most addictive drugs and their effects on the brain. Heroin, opioids. How it works. Binds to mu-opioid receptors, blocking pain and triggering massive dopamine release. Why it's addictive. Creates intense euphoria but quickly rewires pain and pleasure circuits. Long-term effects. Severe withdrawal, brain structure changes, reduced gray matter, and increased overdose risk. Cocaine, stimulants. How it works. Blocks dopamine reuptake, causing excess dopamine accumulation. Why it's addictive. Instant euphoric rush followed by a crash that drives repeated use. Long-term effects. Dopamine receptor downregulation, anhedonia, inability to feel pleasure, and heightened risk of stroke or heart attack. Nicotine, tobacco. How it works. Stimulates nicotinic acetylcholine receptors, increasing dopamine and norepinephrine release. Why it's addictive. Fast dopamine spikes create a strong reinforcement loop. Long-term effects. Increased cravings, withdrawal symptoms, and heightened risk of cardiovascular disease and lung disorders. Alcohol, ethanol. How it works. Enhances GABA, inhibitory, and inhibits glutamate, excitatory, depressing the central nervous system. Why it's addictive. Reduces anxiety and inhibition, making it socially reinforcing. Long-term effects. Brain shrinkage, memory impairment, increased depression risk, and physical dependence. Methamphetamine, stimulants. How it works. Forces a massive dopamine release while preventing its breakdown. Why it's addictive. Extreme euphoria and energy boost, leading to compulsive use. Long-term effects. Neurotoxicity, severe cognitive decline, psychosis, and extreme weight loss. Addiction is a result of brain plasticity, meaning the brain changes structurally and functionally in response to repeated substance use. Understanding this helps develop better treatments, including medication-assisted therapy, MAT, behavioral therapy, and neuromodulation techniques like transcranial magnetic stimulation, TMS.